I would like to welcome viewers from all over the world to this international webinar, whose purpose is clearly stated in the event's title, How to End the Pandemic. It is being sponsored by the World Socialist Website and the International Workers' Alliance of Rank and File Committees. My name is David North. I am the chairperson of the International Editorial Board of the World Socialist Website and the Socialist Equality Party in the United States. I will be moderating the event. My co-moderator is Dr. Benjamin Mateos, a practicing physician who has worked closely with the WSWS in its coverage of the pandemic. We have a distinguished group of panelists, and let me introduce them briefly. Dr. Michael Baker is an infectious disease epidemiologist and public health physician at the University of Otago in Wellington, New Zealand. And he has served as a member of the New Zealand Ministry of Health's COVID-19 Technical Advisory Group and has been a leading architect and advocate for the COVID-19 elimination strategy. We're also very pleased to have Dr. Zayar, who's speaking to us from Pakistan. He is a medical doctor who has worked with the World Health Organization from 2009 to 2013 on the polio eradication initiative as an area coordinator for a high-risk district bordering in Afghanistan. And he will have something to tell us about present conditions in that part of the world. David O'Sullivan is a member of the London Bus Rank and File Committee who was fired for defending his colleagues' right to safe workplace during the COVID-19 pandemic. Dr. Jose Luis Jimenez is a professor of chemistry at the University of Colorado in Boulder. He is an expert in aerosol physics and atmospheric chemistry, mathematical modeling, and disease transmission. Lisa Diaz is a parent in the United Kingdom who is a founding member of Safe Ed for All and a member of the UK Educators Rank and File Committee. Dr. Deepti Gurdasani is a public health researcher at the Queen Mary University of London and has a background in clinical epidemiology and statistical genetics. Dr. Eric Feigl-Dink is an epidemiologist and health economist and a senior fellow at the Federation of American Scientists. Dr. Malgorzata Gasparovich is a developmental biologist and a researcher at the University of Calgary in Canada. Donna is a teacher in Tennessee and a member of the Tennessee Educators Rank and File Committee. Dr. Howard Ehrman is a retired family medicine physician and was an assistant professor at the University of Illinois Chicago College of Medicine and School of Public Health until 2020. He has a long career, both as a physician and as a social activist who has been involved in many causes and has been a fighter for people's rights and their health. I'm pleased that all of these very, very distinguished individuals who have played a prominent role in the struggle against this terrible pandemic are with us today. Since its first posting on the subject on January 24th, 2020, the World Socialist Website has published more than 4,000 articles on the pandemic. Dr. Mateos has personally written 240 of these articles. From the earliest days of the pandemic, when the number of weekly deaths on a global scale were still being measured in single digits, and before COVID was a household word, the WSWS was warning that the pandemic, unless counteracted by an immediate and coordinated global response, would exact a devastating toll on human life. We did not possess a crystal ball. In fact, our reporting and analysis was based on a careful study of the results of scientific research conducted by epidemiologists and scientists working in related fields. Among those whose work the WSWS followed closely are several of the members of today's panel. In calling attention to the fact that the WSWS's coverage of the pandemic dates back to January 2020, it is not for the purpose of boasting. Rather, it is to refute the lie, perhaps the most pernicious of the tidal wave of lies that have flowed from governments and the media, that the consequences of this pandemic could not have been foreseen, that no one knew it was coming, and that, once it began, no one knew what had to be done to stop it. The truth is that the danger of a catastrophic pandemic was the subject of urgent warnings over the past 2 decades. Moreover, once the pandemic began, epidemiologists and other scientists active in the sphere of public health had a very clear understanding of what had to be done to quickly bring it under control. Today's panel includes scientists who are among those who sounded the alarm and identified the measures needed to prevent a massive loss of life. The world has already paid a terrible price for the deliberate refusal of governments to listen to scientists. And so where are we now as we approach the end of the second year of the pandemic? At the end of the first year of the pandemic, that is, as of December 31st, 2020, the official global death toll stood at just under 1,950,000 people. That was already a terrible scale of death. But as of yesterday, with more than 2 months left before the end of 2021, the total official death toll stood at 4,958,947. In other words, an additional 3 million people have died since the year began. Contrary to the daily claims of the media, the pandemic is not fading away, and COVID-19 is not evolving into something akin to the common cold. On August 24th, 2021, only 2 months ago, the WSWS sponsored an international webinar on the pandemic. Since then, the total number of cases globally has increased from 213 million to 244 million. The official death toll has increased by more than 500,000. Listing only the countries with the largest number of dead, the United States, the richest and most technologically advanced capitalist country in the world, has led the world in COVID-19 victims. The official toll is a staggering 756,205. In Brazil, led by Bolsonaro, a homicidal maniac, 605,569 people have died. The number of dead in India is 459,301. Mexico has lost 286,259 of its citizens. In Peru, the death toll is 200,000. In Russia, which is now in the grip of another devastating surge, the toll is 229,528. In the United Kingdom, the country's prime minister declared, and I quote, "Let the bodies pile high in their thousands," end of quote. 139,461 people in the United Kingdom are now dead. Boris Johnson is seeing his wish fulfilled. In Iran, the number of dead is 125,052. But these figures do not convey the full extent and horror of the pandemic's butcher's bill. The Economist, a publication that no one would accuse of left-wing leanings, carries an article titled "The Pandemic's True Death Toll." It states, and I quote, "Although the official number of deaths caused by COVID-19 is now 4.9 million, our single best estimate is that the actual toll is 16.5 million people. We find that there is a 95% chance that the true value lies between 10.2 million and 19.2 million additional deaths." In determining the human cost of a war, the figures include not only the dead, but also the injured. The human cost of COVID-19 includes not only the dead, but all those who have been afflicted by the disease, and especially the long haulers who suffer the continuing effect of infection known as long COVID. For those who will endure the illness for years to come, COVID bears a terrible resemblance to polio. During the past month, approximately 1,700 people have died every day in the United States. The daily death toll is no longer reported by the media. The well-known saying, "One death is a tragedy, a million deaths is a statistic," is being confirmed in the attitude of the media to the loss of life. Confronted with the reality of this continuing disaster, at what point does it become necessary to start referring to COVID not only as a pandemic, but as a form of social holocaust? We are approaching the beginning of the third year of the pandemic. This webinar is dedicated to the proposition that it must be ended. For this goal to be achieved, it is necessary to understand the following. 1. The target of SARS-CoV-2, the virus that causes COVID-19, is not individuals, but entire societies. The virus's mode of transmission is directed toward achieving mass infection. SARS-CoV-2 has evolved biologically to strike billions, and in so doing, it kills millions. 2. Therefore, the only effective strategy is one based on a globally coordinated campaign aimed at the elimination of the virus on every continent, in every region, and in every country. There is no effective national solution to this pandemic. Humanity, people of all races, ethnicities, and nationalities, must confront and overcome this challenge through a vast collective and truly selfless global effort. 3. The policies pursued by virtually all governments since the outbreak of the pandemic must be repudiated. The subordination of that which should be the unquestioned priority of social policy, the protection of human life, to interests of corporate profits and private wealth accumulation, cannot be allowed to continue. 4. The initiative to bring about a decisive turn to a strategy directed toward global elimination must come from a socially conscious movement of millions of people. 5. This global movement must draw upon scientific research. The persecution of scientists, many of whom labor under threats to their livelihoods and even their lives, must be ended. The global elimination of the virus requires the closest working alliance between the working class, that is the great mass of society, and the scientific community. Governments won't listen to the scientists. They listen to the bankers. But the working people will listen to the scientists. Today, our panel of experts will present the critical information that the public must have on the topics of long COVID, airborne transmission versus droplets, vaccine efficacy and boosters, the impact of COVID on children, the role that schools play in viral transmission, the connections between the pandemic and climate change, and debunking the myth of herd immunity through letting the virus rip through the population. Most importantly, the webinar will outline a scientific strategy which, if implemented, could lead rapidly to the global elimination of SARS-CoV-2 and the effective end of the pandemic, saving millions of lives worldwide. The material will be challenging. In our preliminary discussions, Benjamin and I have urged the panel members to say what has to be said, present and explain the concepts that are essential to an understanding of the pandemic, and what must be done to end it.